Hey everybody, it's Dr. Linda from the Vascular Birthmarks Foundation. I hope you can see me. 5-6 computer attempts, like 10 people trying to get us going. I just need to see somebody pop on my iPhone here. Oh, hi Aaron, so at least I know I'm here. Dr. Waner will be joining me in a second. Everybody's been running around trying to get power drives and zip drives, but I'm on my phone. And oh wait, I think Dr. Waner's here, so we're on Dr. Waner. This is the old school way that you and I did the first time, which is with my iPhone. So good thing we both have our glasses on, right?
Yeah, hi. I think you better move it further back.
Wait, maybe we can go this way.
Yeah, that's
except you can't turn your phone while recording. Okay. So we can't turn our phone. Hi, Corinne. Hi, Amanda. We just need to see you. Get in a little closer. I know you don't want to, but get in a little closer to me. Okay, everybody. So, hi. We're sorry for the delay, but it's been like a comedy act, right, Dr. Waner?
Yeah, absolutely.
Trying to get the hospital's system to work for us. I just want to make sure you can see Dr. Waner. So I'm going to be doing this old school, using my finger to scroll up the questions. By the way, this is Dr. Waner.
Hi.
Everybody knows Dr. Waner, our world-renowned vascular anomalies expert. I guess if I'm the mother of birthmarks, maybe that means you're the father.
Yeah, probably.
I don't know. We're celebrating 25 years this year that we've known each other, and we've been through a lot. A lot of people are saying hi.
Hi, Michelle.
Hi, Michelle. She's now one of the VBF board members, one of your former patients. Actually, a lot of your patients are involved with VBF. So we need to see your questions. I can't promise how the technology is going to run. There's 27 people, it's saying, who are on. So thank you, Kristen, for letting us know that it looks clear, because it's the little screen, and it's I'm a cripple. I'm a cripple from using the big laptop and not knowing how to manipulate back to the small iPhone. But we're going to do this. Thank you, everybody, for tuning in several times as I tried to navigate this technical problem. And this is why I start out like an hour early. So we are ready to answer your questions. We have an hour. It is 5:11, but we'll stay on till 6:10 because we started late. Dr. Waner is happy to take your questions. We have our VBF annual conference this September in New York City, and you'll be there along with your team from the Vascular Birthmark Institute. Dr. O, Dr. Rosen will be here, Dr. Geronimus doing his free laser. If you want to register, go to birthmark.org/conference. Hi, Molly. Hi, Juniette. Hi, Sarah. Hello from Ohio. So we're ready to take your questions. And as I mentioned, VBF is heading into its 26th year, but this April is 25 years ago I met Dr. Waner, and that was a time where there was no sending pictures over the internet.
No, so we did everything by
FedEx.
By FedEx and by mail.
And the phone.
And the telephone. I would get letters, and I would call Linda, and she'd answer letters, and things got. And then all of a sudden the internet came, and things changed from there onwards. But as Linda says, we've been together for 25 years? 25 years.
This year, yeah.
Yeah, I met her when I was 15. So.
Well, how's that possible? I was 12.
Anyway.
So we're at Hi, Annie. Annie Beats. Hi, my son has a very light port wine on his face, most of his face except the middle of his forehead and chin. It is it's going to be tricky here.
Yeah.
It is very light and was not noticeable during birth. Today he had his laser treatment with Dr. Mercedes Gonzalez in Miami. His entire face has lightened significantly, but his eyes are red because we haven't treated that area.
Okay, so one of the things and one of the problems is that it is important to treat right up to the lid margin. And it's possible to do that. All you have to do, really, the doctor has to put corneal shields in to protect the eye. and it is possible to do that. So I do treat eyes. If your doctor is not comfortable treating eyes, then perhaps you should ask for a referral to maybe go to somebody who does treat eyes. We treat eyes, we do it all the time, and I go right up to the lid margin. In other words, where the lashes come out, it's possible to treat all the way up to there without a problem. So, and you should perhaps see that and begin doing that.
So she was saying that the doctor's hesitant because the child has glaucoma, but the corneal shield shouldn't be a problem, right?
So even in the presence of glaucoma, you can go right up to the lid margin. It's not a problem. It's not going to change the pressure within the eye.
So Kristen's saying her son's almost 3, and he had that midline capillary malformation, angel kiss, and she said, but when he's hot or sick, it's more visible. Does that mean it'll go away, or?
Hold on a minute. You've got to just...
Yeah, I know. I know. She wanted to know, does that mean it should be treated or it'll go away?
So one of the problems with midline malformations is that about 50% of them, according to the literature, about 50% of them will quote-unquote go away. But I don't think that they really go away, because whenever the child has fever or is embarrassed or becomes red, then they flare up and you can see them. And by the way, they make very bad poker players because you can see exactly what's going on. So you should tell him not to go into professional poker and to always tell the truth, because it'll show. So getting back to serious, so it is possible to treat these and to get rid of them. So if it's bothersome and, if your child really wants to get rid of it or you want to get rid of it, 1 or 2 laser treatments should take care of it.
Thank you.
So this is it. But it's the same, the midline of the front and the midline of the back, but it's the front one that's much more. It's usually V-shaped on the forehead, upper eyelids, and around the nose.
Well, Annie Beats, I believe she's one of your patients. She said her LM lymphatic malformation looks better clinically, though MRI still looks the same.
Yeah, this is it. I mean, what we go for is, what we want to do is improve quality of life. We're not doing cancer surgery. We don't have to take every last bit of malformation away. We're trying to improve quality of life and make the patient live or have a normal life. And if that means that you're going to stay with some lymphatic malformation, that's okay.
Annie wants to know also, other than steroids or antibiotics, is there anything to do when there's a flare-up and swelling?
No, steroids and antibiotics are the way to go. There is a new drug, sirolimus, which is very popular and quite effective in treating lymphatic malformations. And so if you have lymphatic malformation residuum, in other words, a little left behind, we may want to talk about sirolimus. So it's not a bad idea to maybe consult with us again, and we can look at your MRI and try and figure out whether sirolimus would be helpful. So that's, and it may prevent some of these flare-ups from happening.
Do you recommend, Juniette wants to know, do you recommend treating cutis marmorata? He has it on his hands, arms, and legs. So
no, depending on how bad it is. I mean, if it's self-limiting, how old is the child?
She doesn't say.
Yeah. I don't want to completely answer this. The answer is no. Initially, no. But if it's persistent, then clearly we can do something about it. So if the redness persists, we can do something about it.
Yeah, because some of them fade out almost completely, right?
Correct,
so you got to kind of just monitor.
Correct. And also treatment can cause ulceration, so be careful. That's one of the problems that we've seen happen.
With the cutis marmorata?
Yeah.
It's good to know. Leah wants to know, can a birthmark on eyelid and forehead cause double vision? She's 61 and had this problem most of her life.
No. Just a pure birthmark?
Well, she's saying it's a birthmark. She said, I'm 61. I've never had any kind of treatment, so she's likely never had imaging done.
Yeah. The double vision's not just coming from the birthmark. It's coming from something else. So I'd like to see more information. Maybe I'd like to see a picture of the patient. You can email us, and we'll respond, or send us a picture of your birthmark, and I'll tell you if and what should be done about it.
And our staff that are on, Kristen and Scott and everyone, they'll be posting Dr. Waner's email or an email for them to be able to directly write to you. Juliet says a pediatric pelvic AVM in Australia watching, thoughts on bleomycin. We did 8 rounds prior, which helped with hemorrhage.
Yeah. So bleomycin injections are really become very popular and very, very helpful. It's clear that bleomycin is doing a lot more than some of the other sclerosants are doing. One of the things you've got to know with sclerotherapy is that there's a variation in response. So alcohol, for instance, is phenomenally strong, and you can cure a lot of things with alcohol, but there are a lot of side effects from alcohol, and the physicians really got to know what they're doing, and alcohol can cause death. So there have been and are mortalities associated with it. And then it goes all the way to some of the alcohol derivatives, sotradecol, etc. They are less toxic, but not as effective. But bleomycin's out there. Bleomycin is is very effective and not that toxic. There are responses that are adverse, and there are some issues with it. It's not just a walk in the park, but bleomycin is a very, very good drug, and we use it a lot.
So anyone getting it should make sure that person is like an expert in using it, right?
Correct.
Not that they've just started.
Right.
So Svetlana, she's obviously pigmented, and she has a good question. She wants to know if removing the angel kiss will leave white marks if she's pigmented.
Okay, so one of the issues is yes, but temporary. So I've treated 1 or 2 patients of color for midline malformations, and the answer is yes, the pigment will go, and it looks very scary because it takes a while for it to come back, but it always comes back. But I wouldn't do more than 1 or 2 treatments to get rid of it, and 1 should be sufficient.
Juniette, the one with the child with the CMTC, the child's 10 months old, so she could wait for that to fade out a couple years, right?
Yeah. So at 10 months, I would not treat CMTC.
Yeah. Okay, no limb discrepancy either, so that's good. Very purple, though, when cold, which is typical with the CMTC, but she can get a lot of clearance.
Yeah.
Leah's saying, port wine on her forehead, the one that has the headaches.
Mm-hmm.
Yes, Juniette, you can email Dr. Waner. Our experts all answer questions, even if you're not their patient, correct?
Mm-hmm. Correct.
Hi, Megan. Tiana says she's 32 years old, has an extensive VM involving the left back flank soft tissue, looking to try and become pregnant. Would the VM make my pregnancy high risk? Would you recommend any genetic testing to see if I carry the gene that would be passed on to the child?
Okay, so it sounds like a very extensive vascular malformation. Probably it sounds very much like a venous malformation. So the answer is yes, it will become a little more difficult in pregnancy. There will be an increase in symptoms during pregnancy. So it's a good idea to maybe see one of the vascular anomalies experts and get counseled by him or her as far as pregnancy is concerned. Now, will it be passed on? Well, a percentage of venous malformations are genetic, but very few are inherited. So the likelihood of your child inheriting something from you is very, very, very low. Very, very low.
So I'm not sure Juliet's question. She's had 17 embolizations as well to date. Resection done in 2016, port wine covered buttock. possibly KT, right? Or maybe
I'm surprised at embolization.
17.
Yeah, David Lord's treating. Okay, so David Lord's a very well known, very well respected interventional radiologist in Australia, so he knows what he's doing. It's hard to comment on that without actually seeing the patient and seeing any of the pictures, but David Lord is a phenomenally good interventional radiologist. He really knows what he's doing.
Sibel Prado, I'm not sure you can answer her again without pictures. She's saying, should we use the V-beam, the pulse dye 532, or YAG or 1064 for vascular birthmark on face? But I guess it would depend.
Yeah,
right?
So it depends on, I'd like to see the birthmark.
Yeah. Okay. Hi, Jackie. Her daughter was the one that had the chest wall, giant hemangioma that you and Teresa removed.
That's right. I remember.
She's one of my birthmark babies.
How's the little one doing?
She's doing great.
Excellent.
Yeah. I stalk Jackie all the time and keep up with the babies. So she's saying hi. Razio says, I have a 7-year-old with one still, possibly a hemangioma.
Okay, if someone has a hemangioma at the age of 7, it's not going to go away. So that's something that we really ought to remove. You can get in the picture as well, Linda. There we go.
Okay.
We're very
it's a
cozy
good thing.
here,
It's a good thing we're both so thin, right? Juniette is saying her dermatologist uses a Candela pulse dye laser. Do you like this machine?
Yes, yeah.
Yeah.
So the Candela pulse dye laser is the standard of care. And now there are older versions, there are newer versions, but the pulse dye laser is the standard of care to treat port wine stains. Now, it should be optimized in terms of spot size, and ultimately we shouldn't really be using less than a 10 millimeter spot size. The newer machines have bigger spot sizes, but one of the things that we need to know is, I come across this question a lot. Does a bigger spot size mean you're going to get better clearance? And the answer is scientifically no. There's something called Monte Carlo modeling, which is a mathematical modeling of what happens when a laser impacts on biological tissue. And what's been said and what's been calculated, and we did some of our own modeling at one stage when I had a physicist who worked with me, and the findings are that up to 10 millimeters you increase depth of penetration, but beyond 10 millimeters, in other words beyond 1 centimeter, you don't get any specific advantage. The only advantage is a bigger surface area.
So you're done quicker.
Yeah, so you're done quicker, but I don't believe it's more efficacious.
And she was also saying, she's bringing up the Prima laser, which we all know is new. Should she stick with the V-beam, or should she try for the Prima? I know they're still sorting things out with the Prima.
There are a lot of unanswered questions. Now, one of them concerns the use of neodymium YAG lasers. So I've used neodymium YAG lasers on vascular lesions for, ever since I can remember, probably for 15 years or 20 years or something. So I know a lot about YAG lasers. And with a YAG laser, your therapeutic index, in other words, the parameters that you can use and not get in trouble are very narrow. So your therapeutic index is very narrow, and if you wander out of that just a little bit, you'll scar. So what worries me is that in inexperienced hands, the use of neodymium YAG lasers is going to cause havoc and scarring. So I worry tremendously about that. I hope that I'm proven wrong, and I hope that this is not the case, but unfortunately it could be. be. So be careful with lasers.
Mentor is saying hi from Albania.
Hi.
Katie Siegfried saying her daughter's venous malformation on her left cheek, side of nose, and near eye has been treated 3 times with sclerotherapy, bleomycin. The last time was October, and she has some residual hard swelling in the VM. Our radiologist recommended scar tissue massage and OT, I guess occupational therapy.
So how long ago was it?
October.
October. So, I mean, we're still just in February, so what probably happened was there was some inflammation and it formed some fibrosis, and eventually it should resolve. So, yeah, I agree with scar tissue, and I agree with massaging the scar tissue and just waiting. But if it doesn't wait, then it's time to remove it, and it can be removed. Sometimes a steroid injection will help. I was going to ask you if you would
inject with steroids.
But be very careful with steroids. You know, you can go from bad to worse, so you can get atrophy of the skin. So should be done by they're doing. Hi to Norway.
Yes, so I was just going to say, Linda Rexon from Norway is saying hi.
Hi.
Jessica is saying, thank you for doing this. Mary Elizabeth Raya will be visiting the office next week. We are looking forward to her session with you.
Okay, yeah, hi.
Yep, to the next steps. Elizabeth is on. Hi, Elizabeth. Julia is saying, this overall live post is extremely important to us around the world. Please continue to do it. We've been doing them every month since January of 2017, and we have 100,000 visits, and they're all there. You can go back and see Dr. Waner. This is like our 4th one, I think, together.
Mm-hmm. So David Lord is really a phenomenal power in Australia. You know that I have an Australian passport, so I lived in Sydney for a long time, so hi to Australia.
So Juniette's saying that they went up to 7.5 and got crusting of the cheek and bruises, so they went back to 7 for a setting.
Okay, that's fair enough.
Okay.
You know, crusting is not good. That means that the skin has been damaged, so you don't want to go that high.
So Annie wants to know what can be done for scar tissue left from sclero or doxybleo.
Yeah. So once again, I'd have to see the scar tissue. There's usually a lot we can do with scar tissue. There really is a tremendous amount, but I'd have to see a photo of the scarred area to get some idea of how bad it is. Sometimes we resurface it, sometimes we excise it. So there are various things that can be done, but if you send a photo, we will answer. Between Dr. O and I, we always answer, and she is up at like 5, 6 in the morning answering emails. So we do take care of this. Can laser treatment be done on a buttock in a 12-week-old? Yes. Early treatment. I really, really believe in early treatment. And I know that there's a lot of controversy about whether scientifically this is true. Some people have reviewed the literature, but early treatment is really very, very important, especially.
And if people can get access to it, that's the hard part. We do have a dermatologist in Australia. I have his email. I don't know if you know of anyone, but he does it, right in his office. He does use anesthesias.
Yeah.
And
so early treatment, the most important treatment for a port wine stain is the first treatment. I believe that because you get much of your clearance then, and subsequent treatments are important, but the first treatment is important, and the younger the child, the better they do.
And the technician too, because the first treatment is the most significant if they know the right settings and what they're doing, right?
Mm-hmm. Let's see this.
Okay, so Ashley has a 7-month-old with a hemangioma on her forehead, tried propranolol. She had a bad reaction, drop in blood sugar, which we've heard about. Right now, we're not treating. We are interested in having it removed.
Okay, so definitely, and I can say this with confidence, children heal much better than adults or older children. The younger the child, the better they do. So as soon as anesthesia is not a problem, certainly after 6 months in a child who's not a premi, who was not a premature infant, I would go ahead and remove it as soon as possible. certainly within the first year of life or around 1 year of age, because that'll stop recurrence and you'll get a very good scar, and that's very, very important. So I would encourage that person to get surgical treatment and go to a surgeon who knows what he or she is doing.
And you can, like, we've posted his email on here, and you can easily send the picture to Dr. Waner, and he can give you a free online consult. Matthew wants to know, and I'm not sure what he's talking about, creams, because there's two types. You recommend post-laser, because some are using like a topical rapamycin cream, but some are also using the Emla cream, so... for a 19-month-old baby.
Yeah, so I don't know. I don't know the answer to this question. We typically don't use rapamycin because it hasn't really been shown to be beneficial, and so if I'm going to use some chemotherapeutic agent, I need to be sure that it's beneficial, and rapamycin has not been shown. Stuart did a very large study and did not find any
Dr. Nelson and
advantage.
Dr. Geronimus both say that, although there are many doctors that are saying that it does help. So Anna says, hello, can a large surface area vascular malformation, port wine stain, be somewhat excised from the torso area? My plastic surgeon tried to suction in 2002, but had to stop due to high vascular area bleeding. I'm from upstate New York, so yes.
So the bottom line is that once again, if you're in New York, send me a photo or
me, because if she's upstate, she might be in the Albany area.
If this is a true vascular malformation, then liposuction will cause some bleeding. Or if it's an involuted hemangioma, sometimes these are very vascular. So let's see a photo and we'll see what we can do. Good day, mate.
That's Dylan. He's our employee. Hi, Dylan. He's always good for making us smile. Annabelle. Hi, Dr. Waner. Sabas. I'm so grateful with all the surgeries I had with you. So that's Annabelle Sabas.
Nice to see you.
Svelta Mora, what would be the chance of ulceration of hemangioma after laser treatment on a 2-year-old?
Okay.
Does the hemangioma still active? We did first laser at a conference in Italy, so when we were out there. And when she was 9, we did the other doctor, and hemangioma ulcerated very badly after the laser, and she has scars now. Okay,
so the issue is that, in fact, we published this paper which alerted people about this. One of the problems is that if a hemangioma is actively growing, especially segmental hemangiomas, early laser treatment can cause ulceration. And we've shown this, and it's been shown time and time again. So you have to wait a period before doing laser treatment. And but I would imagine that by 2 years of age, the likelihood of seeing ulceration from laser treatment must be very low. I would proceed cautiously, so we can start with test patches. If the test patches are fine, you can then proceed. So another one of my Aussie mates.
Yes, Australia.
Day,
it's
mate.
Tiff. Hi, I have a 2-year-old with a V2 port wine, and I have been led to believe it wasn't maybe genetic. But now I have a 9-month-old who also seems to have a port wine on her face. And she said, in some cases, can port be genetic? I have 3 other children, all boys, who don't have it. It seems to have affected the last 2 born and both girls.
Okay, so the official answer is no, it is not inherited. Genetic means that something went wrong with a gene that caused a problem. But there's a difference between genetic and inherited. Port wine stains are not inherited. Several people have looked at this and have looked for whether there is an inherited element, and fortunately there is none, so they're not inherited.
There's your patient, Alaha Hanyang, saying hi.
Hi, how are you?
Marianne Esquel, hi, Dr. Waner in Miami, said we could try Rofade cream on a port wine stain. Thoughts? I've never heard of it.
I don't know it. I really don't know much about it, so can't answer.
Hi, Linda. Friend of mine. Hi, Anna Fox. Thank you for saving my daughter. You might remember Anna. She's 10 now.
Wow.
And who needs nose and lip reconstructive surgery. Do you recommend it now or when she's an adult?
Yeah, absolutely now. Yeah. Don't, if she needs reconstructive surgery, earlier is better for sure. It helps with self-esteem, it helps with a lot of issues, so I would do it.
So Nancy Dunn Afato says, hi, Dr. Waner. It's Nancy, Alex's mom. You did lip reduction surgery on his bottom lip before Thanksgiving. He's looking great. See you at the end of February for his upper lip surgery.
Oh, yeah, that's right.
You are the best.
Thank you. Thank you very much. I look forward to seeing him.
Sindai says, hello, pigmented birthmark can be lightened when they get younger. I think she means, can a pigmented birthmark get lighter as they get older? And if it's brown, they don't get lighter, do they?
No. Typically
if that's
not.
what she's talking about.
No.
Sindai said, good morning from the Philippines. Sherry Arnold said, hi to both of you. I have a very extensive VM, the whole circumference of my neck, with a port wine stain on right shoulder. I have had 9 bleo treatments so far, last about 2.5 years ago. I'm approaching menopause and have been advised not to take hormone replacement treatment. Would you agree? Also, what would you suggest for relief while VM is engorged?
Okay, so, clearly hormones affect, especially estrogen, will affect birthmarks. What they do is the estrogen will soften the tissues and can have a negative effect on birthmarks. But I don't know if hormone replacement therapy is going to have that much of an effect. There are different ways of doing hormone replacement therapy. There are different remedies. And so what I would do is I would look for somebody to work with and try various remedies and see which one doesn't have any effect on the birthmark or has minimal effect on the birthmark. So I would not stop hormone replacement therapy just because of a birthmark. You can still get treatment.
Yeah, one of our OBGYN experts from New York City, he said if throughout your life your port wine stain was not reactive or during your period, your menstrual cycle, then it's not. But if it was very reactive, painful, then through menopause you'll be susceptible.
Okay.
So I thought that was a good thought.
Here, Bryson Haddon.
Yeah,
hi.
Brittany Hayden saying hi, so thankful you helped Bryson a lot.
Thank you.
Gustavo Martinez. Hi, Dr. Waner. My best regards. My son was treated by you in New York in 2010. We are from Venezuela.
Okay. In fact, I remember the family.
He's 13 years old and healthy without hemangiomas. Thank you.
Even at this old age, I still remember a lot of my patients.
Thank God some of the memory cells are working. Jayesh says, apologies if I missed it, but did I hear correctly that rapamycin does not help with lymphatic malformations?
No. Rapamycin topical does not help with port wine stains.
Right.
Okay? Rapamycin does help with lymphatic malformations. So but not topical for port wine stain treatment.
But now he goes on to say, I'm currently waiting for approval for coverage of rapamycin for my CVM. So that's capillary venous vascular malformation, right?
Yeah, that's different.
Okay.
Yeah.
Michelle, hi Michelle. Jane Z is saying good morning.
Good morning.
Brad is saying, hi Dr. Linda, it's wonderful to see you still helping so many people. Thank you, Brad. Jody Maurer, you remember her.
Yes.
She's been at many of our conferences. She's one of our ambassadors. Margaret, hello, my son Nathan is pending surgery with Dr. Waner. He's got a port wine covering the left side of his face with tissue overgrowth. If fat tissue is deposited under the left eye orbit and is removed, does it have a chance of coming back?
Okay, so the answer is yes, it does. But once again, we can't cure this, but the object is to improve quality of life and make the child or the adult look normal. Yes, there will be some regrowth, Just how much is not known, but you can expect to have to do something 5 or 10 years later. That doesn't mean that you shouldn't do anything, because it's just going to come back. If you leave it alone, it's just going to be much worse. So it's better to do something.
So Jeansy, without seeing a picture, but she can always email you, is asking if it's possible that her child's birthmark will be gone as she gets older, but you wouldn't really know unless you look at the picture, right?
Yeah, I got to look at the picture.
Yeah.
Send a picture and we'll answer it.
Kennedy's Cause, thank you both. You're welcome. Renee Garrett. Hi, Renee.
Hi, Renee.
She's been reaching out to you a lot.
I know.
She's
we'll get back to you, Renee.
So
I've been, Dr. O and I have been looking at all your emails, and we've been discussing things, so we'll get back to you, Renee.
Thank you. Jean Z is saying it's under her lower left chin. Oh, well, that still doesn't help. We don't know what it is. Under her lower left chin, it could be a hemangioma, port wine, venous.
So send a photo and we'll have a look.
Yeah, we can't, photos can't be sent during our live, but Dr. Waner's email is posted above, so you can send a picture to him. Phyllis is saying, after years of pulse dye laser for port wine, I had a first prima. Always had a lot of swelling with,
Pulse dye, yeah.
With pulse dye. Had a lot with pulse dye.
Mm-hmm.
No swelling with prima and no fading. Is this because it's too low?
No, I can't answer that question.
Yeah.
I need to know what settings. I mean, if there was no improvement and no swelling, then possibly the settings were low, and maybe the doctor was just trying to be very cautious using a new laser and started off, because all these lasers come with factory settings, and the factory tells you this is where you need to start, and the settings that they give you are invariably so low that they're almost homeopathic. And I'm not using that word in a derogatory sense, but from a laser standpoint, they're not really going to do much. So it's the doctor will have to learn by experience.
Renee wants to know if it's safe for her or recommended for aspirin for pain management.
Yes, aspirin's fine, Renee.
Okay. Carol Rawls Stansberry says, is there an orthodontist specialist? My daughter has port wine on the left cheek, through the temple, under the eye.
Mm-hmm.
Lip pencil is almost on left top gums.
Okay, so there is I work with a group of a maxillofacial surgeon and a periodontist and a whole team. And there's a Dr. Brecht, who's from New Jersey, who's just phenomenal in working on people with vascular malformations in the oral cavity. We have a group of surgeons called Next Gen Face. We're just a group of doctors that look at difficult problems and come up with solutions. And in our group, we have a maxillofacial surgeon, and we have all prosthodontists and various dental specialists. And so we very often see these problems. But just a simple port wine stain. David Darrow did a lot of work on this,
right.
And David can answer your question. But typically, it's safe to have dental work in the presence of port wine stains, even if the port wine stain involves the gingiva, the gums.
So, Carol, we also have our Vascular Birthmarks annual conference, September 25th and 6th in New York City. 26th is the actual conference. But on Friday, in addition to the free laser, we'll be, and we're working on it now, offering free orthodontist exams by Carol Fenn. She's been doing them. She's an orthodontist with a port wine. And free dental exams by Dr. Darrow. So you can check out our website at birthmark.org/conference and at least get a free opinion or, come and get a free exam. Elizabeth Pry Dishman, she said, hi, doctors. Row Fade is a cream for rosacea that temporarily constricts port wine stain. Rocks. She's worked with rocks. So temporarily constricts superficial blood vessels, therefore reducing the redness of rosacea. it is shown to work on smooth muscle and has not been shown to be helpful in port wine. I believe some of Rox's fellows looked into using it post V-beam to constrict vessels and further damage them after treatment. They found no improvement. I've tried Rofade, no difference in my port wine.
Okay, thanks for that information. That's very important. Thank you. Thank you.
Hi, Dawn Henderson Scruggs. That's a name, I think, from years ago that I believe that you treated her child. Margaret Kinney, hi. Blessings to both of you. We will see you soon, Margaret Kinney. Renata is saying hi. Annie Beats again. Thank you for answering. I greatly appreciate these. Amy Swenson, my son, 3.5 years old, received laser on his port wine and got lots of clearance. It seems like the port wine stain actually got darker after his last treatment. Is this a common thing? We haven't pursued maintenance laser since it reappeared and got darker after his last treatment.
Okay, so here's the issue. Sometimes after laser treatment you can get something called post-inflammatory hyperpigmentation. So the body produces extra pigment as a result of the inflammation after the laser treatment. And so it looks like the birthmark is actually getting darker because in healing the body has produced this pigment. Generally speaking, the pigment is very temporary and it'll eventually fade. So it looks like it's gotten worse, but in actual fact it hasn't. Now, it's not safe to continue treating if there is this pigment. You've got to wait for the pigment to fade, and it's possible to fade it with hydroquinone or their various treatment combinations, but that's what's happened most likely.
So Elsa Brianis is saying her granddaughter has a vascular malformation, same as Christine's, my daughter, which you removed her hemangioma. So we don't know if it's a hemangioma or an actual malformation.
Yeah.
So I guess you'd have to look at it to give her the advice of...
If there's a hemangioma and it's causing distortion of the lip, etc.,
right.
Just remove
Surgery.
it or treat it. But I'd have to see the
pictures.
Thing. Hi, Miss Rooney. How are you?
She's saying, hi, Linda. Just want to say thank you for continuing treatments and support for Abby. Carolyn. Hi, Carolyn. She's from the Netherlands.
Yes.
Good
Hi.
Milton and Linda. Inspiring this live session. We can learn from this in Europe. See you soon. She'll be at ISVA.
Okay.
Gabby Renee is saying regards for Dr. Waner from Argentina. He treated my son.
Nice to see you.
Franco DiMartino is saying thank you for the amazing work on our son, baby Matteo.
Oh, thank you. Yeah, hi. So, and it was a great, you guys did a very great show. The TV coverage was excellent. Thank you very much for that. You really raised a lot of awareness.
Is that the lymphatic malformation?
No,
this
is the child who had a mixed malformation.
Mixed one.
And has done exceptionally well. Thank you.
All the awareness is what makes a difference in the world
difference.
for everyone understanding to diagnose and treat these early, right, Dr. Waner?
Absolutely, and families can raise awareness as has happened by just speaking to other families. That's important.
And we have our Global Ambassador program, and if you're interested, you can be a VBF Global Ambassador and help us raise awareness.
So does doxy or bleo damage teeth, or the actual lymphatic malformation affect teeth, permanent teeth? I'm not aware of, I know that doxycycline taken as or tetracyclines taken as antibiotics can stain teeth, especially unerupted teeth. So, it's a good question. Will intralesional doxycycline actually cause tooth staining? I don't know the answer to this. I would defer to David Darrow, and I'd be interested to know what David Darrow says. There's always a chance that doxycycline is absorbed, and if there's a high quantity that's absorbed, sure, it can stain teeth. Tetracyclines can do that. The other sclerosants do not affect the growth of teeth. So, and tetracyclines will not affect the growth of teeth, but you can get tooth staining. I guess. So I'd like to know what David Darrow says.
Yeah, so
I've never seen it.
Yeah, Dr. Darrow is one of the experts on our page, and you can email him, and when you do, email me and Dr. Waner so we know the answer. Kristen is saying, do you have any information on a new drug called Nephthera for VM and LM?
So I'm following this very closely. At this stage, we don't have too much information, but the potential is very exciting. So it is a new drug, and we'll be hearing more about this in the future. But at this stage, we don't know. Hi, Fiona Kelly.
She's from Australia, port wine. What is your opinion on what a birthmark is? I've been given so many reasons why I was born with one, and no one in my family has one. So she has a port wine.
Okay, so it is if it's a port wine stain, that's what it is. And hold on, I got to stop this. So if that's a port wine stain, then that's what it is. It's called a capillary malformation, and it's made up of dilated capillaries, or dilated, actually they're not really capillaries, they're little veins. So the little veins are dilated and filled with blood, and that's what gives it the color. So if you actually go ahead and push on the port wine stain, you squeeze the blood out, and then the color goes, and then it comes back. So that's simply what it is. It's an abnormality in the little veins, which are dilated and filled with blood.
And didn't Dr. Comey and her team find the mutation for this? So, I mean, it's nothing she did or her mother did.
It's not inherited.
Yeah.
You didn't inherit it. You were born with it.
Right.
There's a genetic abnormality just in the area of the birthmark, and you won't pass it on to your children, so don't worry.
Elsa says her 16-year-old granddaughter had a venous malformation lower lip. It was operated on before. Now it's reappeared after a year.
Yeah.
Which that can happen.
Sure, that can happen, but if you want me to give an opinion, I'll have a look and see what it is. So
you can send a picture to Dr. Waner.
Send me a picture and let me have a look and see.
Yeah.
So I'll see what I can do to help. Venous malformations can come back, and if it does come back, then we've got to look for another alternative way. And there are other ways to treat it.
And also, isn't it, again, the technician, like if you don't remove it all or properly, it can come back quicker?
Yeah, but you see, you walk a fine line because you want to improve quality of life. You want the patient to look normal. And sure, we can go ahead and remove everything, but you're going to cause some disfigurement, and that's not what we want to do.
No, not at all. Hi from Algeria. Hyatt Kennedy saying, I'm 22. Is there an age limit on patients you treat? Absolutely not.
Not at all.
0 to 100, right?
Yeah, so
She visited you a few times years ago. The name sounds familiar to me, too. Okay, Annie again said thank you. Jayesh is saying thoughts on the use of neuromuscular Electro stimulation to treat non-healing chronic wounds in patients suffering from lymphedema.
Yeah, I don't have any first-hand knowledge of this, so I don't know. And there are all sorts of ways of trying to improve healing. So I really don't know. I don't have much knowledge on this. Sorry. I can't answer that.
Erica said, thank you for all you do. My son had a hemangioma removed when he was 3 months old. Now he's 10.
Thank you.
I cannot read that. It's in a different language. But hi. Dominica is saying, thank you, Dr. Waner. And with Dr. O, treats my daughter Natalie for port wine. She has amazing results.
Thank you.
Havas Patients Group. Havas is watching. The group.
Yeah.
Dawn Henderson Scruggs again is saying, yes, you and Dr. G treated Abby years ago. Yeah, I remember that. You also performed her first lip debulking. I actually have her photo in my album before we were getting electronic photos. Mm-hmm. She's been in our network for many, many years. Mm-hmm. Education is the key. Thank you both for being there when she was a baby and pointing us in the right direction. And, we've never veered from our mission. You can say that. You've known us for 25 years. Educate the patient, educate the physicians. That's always been our mission. Same as you.
Sure.
Right? Same as you. Christy Holly Richards, Dr. Waner has been taking care of my son Devin Lee for many years. We love him.
Yeah.
Will there be another? Svetlana wants to know if we'll have another conference in Europe in the future. We are in discussions right now for Serbia.
Okay. But Svetlana, I do go to Berlin, and I go about 6 times a year to Berlin, and I'm happy to see anybody. It's very easy to get to Berlin. It's not that far. So if you're interested, please get in touch with me. We have a clinic in Berlin, and I'll be there in a few weeks from now, I think March the 7th or 8th or something like that. I'll be in Berlin.
And could they just email you to get where to meet you and how?
Sure.
Yeah. Okay. Hyatt's saying my son of 4 years has hemangioma on his bones. Many bones were damaged. His vertebral colon is touched too. Don't know what to do. Sounds like a complex case, right, Dr. Waner?
Yeah. So as far as that's concerned, the person to go to is if it's a spinal. If it's a spinal lesion, Dr. Berenstein here in New York is very experienced in treating intraosseous, in other words, lesions that are in bone. And so I would see a good interventional radiologist, Dr. Lord in Australia, Dr. Berenstein here. These are the guys who usually do this type of work.
Thank you for that, Dr. Waner. Elsa is saying, thank you so much for the reply. I will send pic of her, God bless you, from the Philippines. Mm-hmm. We are at 5:59. We will take a couple more calls, but sorry that we had a little technical difficulty, but Dr. Waner, you came through like a champ, even if my arm and my back are going to kill me from holding this. But, I mean, you want to take a few more questions? It's 5:59, and then we can sign off. Alrighty, so I think because we normally finish at 6, it's probably stopping.
Yeah.
So anybody have any additional questions, you can email Dr. Waner. Any advice or references looking to become their own clinical care coordinator. I need to figure out how to manage my health care from top to bottom between multiple physicians. Boy, that's a really difficult thing, and that's...
Speak to Linda.
Yeah, I mean,
Linda knows about that.
That's one of the things where I'm actually going to Italy and meeting with Operation Smile, who is working on a plan about comprehensive care for these complex situations. So hopefully we'll have some information, but stay in touch with me. Yes, and Hyatt can send you pictures. Julie is saying, my 5-year-old has a venous malformation in his left thigh. They won't remove it due to the muscle being involved. Had several embolizations, but they only reduced the size for a few weeks, but then it goes back. His pain level has gone down. I'm considering stopping treatments.
Okay, so, for intramuscular venous malformations, from time to time we do remove these. Even though we'll remove some muscle, we'll make a determination as to whether there will be any deficit or problems associated with that. And if there isn't going to be, then it's quite okay to go in and do something about it, especially for a lesion that's painful. So, this is something that needs to be evaluated by a group, including an orthopedic surgeon.
And I can just throw it out there too. I know Dr. Coletti just removed an intermuscular venous malformation. I mean, we do have doctors in our network that can give some opinions. This is a complicated question, and I mean, we'll be wrapping up with Michelle Dugan. I'm a parent of a child with a widespread port wine from head to toe. As time has gone on, it's not caused problems apart from appearance. However, she's been complaining her head hurts, and she can see it's slightly swollen like her leg can get. I'm very worried as my aunt had the exact same birthmark, and when she hit puberty, the port wine stain started to grow and caused her to go blind and be very disfigured due to growth of the birthmark. Thank you. I mean, I think we can just have Michelle send you pictures let us know where you're from.
Yeah, so that's something that I can advise you on, and I'd be happy to entertain any emails or something like that. I think we got it.
Yep, and Hyatt, I mean, the emails are there. You can look above where you're very welcome. The emails are going to be posted again. There's mine and there's Dr. Waner's. Thank you both. Thank you, Dr. Waner. Sure. And any additional questions, feel free to write to us at birthmark.org. We're on the front on the Ask the Expert, or write to Dr. Waner. And signing off, thank you, Dr. Waner, for your time.
Yeah, thank you.
And we'll be back again in a few months.